welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division, including the PACE program. And today we are going to talk about the PACE program. PACE means Program of All-Inclusive Care for the Elderly, beginning at 55. Gives me a little agita, but I have to say it because it's true. And we also refer to the program as the Elder Service Plan of the Cambridge Health Alliance. So you may see the vans driving through the streets. Today, I'm excited that we have Allison Horowitz, who is a social work supervisor as well as a site manager for our Malden site. Hi, Allison. Welcome.
Thank you, Roberta. Happy to be here.
Thank you for joining us today. So I thought it would be important for us to talk about the, people hear me talk about PACE all the time, and but we want to, you are actually part of the clinical team that takes care of the people that enroll in our program. So tell us from your point of view, first tell us who the team is made up of.
So there's 11 disciplines. So when you enroll in our program, you have access to these disciplines, which range from your doctor and your nurse practitioner, of course, to your nurse, to your social worker, physical and occupational therapy, and transportation activities. And we all sit every morning and work as a team and discuss the care for our participants. And we call them participants because they really work with us and participate in their care with this great team of professionals. And you really don't get that in the traditional model, which is very top down. You might refer to some place, but there's no coordination and there's not that extra step to make sure someone knows about their appointments and is getting to their appointments and is getting the follow-up and is being referred to the right places. So it's a real tight coordination of care, and I love coming to work every day and doing what I do.
And I love it too. I've been here 13 years and definitely I have passion for the program. We help the people that would typically fall through the cracks and then not have anyone. You know, I took care of my own mother, but not everyone has a me. So now they have us and they have the whole team. And I often equate it to Cheers, the center is Cheers. And the tagline of Cheers, I don't know, you might be too young to remember this, but some of my friends will remember it out there. The tagline for Cheers was where everybody knows your name. And so they can be sitting in the center and you might walk by or I might walk by or their doctor might walk by and everyone gets to know them. It's a very kind of a warm and fuzzy center.
Absolutely. One of the favorite parts of my day is walking through the center and saying hi to people, maybe doing a little dance or getting into one of the activities. But that's really the joy of it. And you're right, everyone knows you, and it's really a big community. We all love coming to work and doing what we do. And our participants, the PACE model is, a national it's a national model, Program of All-Inclusive Care for the Elderly, which if you're a long-time watcher of Roberta, you know. But, and it's really, the day center is such an integral part of that. And I love seeing the participants there every day.
Right, because not only can they come in and participate in activities, but the whole medical team is right there. So, if anything happens while they're with us at the center, then their team is there. Mm-hmm. And we're available to them 24 hours a day, 7 days a week, right?
Yeah.
We support them. So as a social worker, what might be some of the things that are services or circumstances that you have experienced with PACE in dealing with our participants?
Yeah. So social workers wear many hats, and we are obviously one of the disciplines on the team. We work with the other disciplines, and our role is really the mental health component. You enroll and you get a social worker. You may not really need to see us very often, or you may have something difficult going on and you want to check in with a social worker for some more short-term supportive counseling, it all depends on the participant, and we really create a care plan that they want and that works for them. We're certainly assessing mental health needs, but we're also doing quite a bit of family work and communicating with families, coordinating with the team. It's all very individualized.
And other providers that they might need if they need to see a mental health specialist, or and the important thing is that we contract with and partner with other organizations that are expert with mental health, because PACE wasn't necessarily set up for the folks that had high psychiatric issues, or but now with our partners we're able to take care of all that, right?
Yeah, we have some great partners, so we make sure that our participants get the care that they need.
So can you think of any circumstances or situations that you might have really helped someone through something?
Sure. I mean, it happens just depending on someone's needs, as I said. We all want to find purpose in our lives, and as we age, we may not do the things that we used to do. We may no longer be working, and our children may be grown. So I think that really the heart of not just social work, but all the disciplines, is to give our participants the best quality of life and really a purpose. So whether they have a functional need, this isn't, I guess, just social work, but if, our rehab staff and our physical therapy staff is terrific, occupational and speech therapy, to really help folks meet their potential, and social work is certainly a piece of that.
So as a social worker, if you were talking to someone and working through some issue with them, and something else came up, maybe you noticed that they weren't too steady, or that maybe the cane that they were using, they weren't using properly, then would you talk to the physical therapy and give them a heads up and have them then work with that person?
Yeah, absolutely. That comes up all the time. Or if they don't have nutrition at home, we look in their refrigerator and there's really nothing there. We'll connect with the registered dietitian. We have some great dietitians on staff. And they will also come to us if they say, this person's seeming a little down. They, might benefit from a social work check-in. So that's exactly what we do.
Goes back and forth.
Yes, yeah.
Which is part of what you were talking about, that tight level of care. Mm-hmm. That the whole team, every single person on the team knows the people, every single participant on the program. So we have the advantage to be able to walk them through. And sometimes even for me, if I walk through the day room, they might call me over and they might express something to me, and that they might not have said, or might not have been in the presence of the appropriate discipline. So then I pass it on. Mm-hmm. So we all work together. So I just want to reiterate the things that we provide. We provide all over the primary care. We provide any hospitalization, any short-term rehab, even long-term care placement. We take care of people right through to the end of their lives, and I think that's so important. Mm-hmm. We never tell them they're too sick or they're too old and they have to leave the program.
Yeah.
We take care of people right through to the end of their lives, which is an unusual aspect. We are both the insurer and the provider, and most insurances aren't like that.
Yeah.
So we're the different animal out there.
Yeah, and at the end of life is when our participants and their families, they really sometimes need us most. We've known them, and that's really a great privilege that we can do that.
Right, and it helps, I think, support the caregivers, the family, as well as the person that's transitioning.
Yeah, our families are part of the care team for sure.
Right, so it extends out, and that's an important point too, that the team shares the care with the participants, and the families that are on board. So if someone is in their own, whether it's independent apartment or in their own home, and maybe they're a little isolated when they're there, or maybe they're just not doing well there, would you work with the team to recommend maybe a supportive housing or an assisted living for them?
Yeah, absolutely. That comes up as well. We're not, a housing agency, but we certainly have.
We partner with them.
We absolutely have great partnerships, and that's certainly part of it. And that's a big social work responsibility as well, to kind of provide some education surrounding options. Our goal is really to keep people, as you said, we do follow them to the nursing home and to the hospital. Wherever they go, we are following that care, so we can pick right up and prevent that, to keep people home. That's really our goal. But certainly we have some great agencies that we partner. We have some great partners.
Right. I know. I have in my experience, some people will say, well, they need